Are you finding it harder to recall things lately? Ever wonder if the medications you're taking could be affecting your memory? Could your daily pill routine be speeding up cognitive decline without you even realizing it? If you're concerned about memory loss after 60, knowing which medications could be working against your brain is critical. Anticholinergic drugs, often prescribed for various common conditions, have been linked to memory problems, confusion, and even increased risk of dementia. In this video, we'll uncover 8 anticholinergic medications you should be cautious about and explain how they impact your cognitive health. The main goal of this video is to inform older adults about the effects of these medications, avoiding them if possible, or using them with caution, be it necessary. Stick around to learn how to protect your brain while still managing your health conditions. Now, what does it mean for a medication to be anticholinergic? Anticholinergics are medications that work by blocking the action of acetylcholine, a neurotransmitter involved in many functions, including muscle movement and memory. These drugs can be effective in treating a variety of medical conditions such as allergies, bladder control issues, depression, gastrointestinal problems, and insomnia. However, their impact on the brain's cholinergic system can lead to cognitive side effects such as memory loss and confusion. The cognitive side effects of these medications occur because acetylcholine is essential for processing information and forming memories. By blocking this neurotransmitter, anticholinergic drugs can interfere with these critical brain functions, leading to memory problems, difficulty concentrating, and general cognitive decline. Older adults are more vulnerable to these effects due to already lower levels of acetylcholine and changes in how their bodies metabolize drugs, making it easier for these medications to accumulate and cause harm. Now let's dive into the 8 common anticholinergic medications to avoid if you're worried about your memory. Number 1. Over-the-counter sleep aids. Sleep is essential for maintaining cognitive health, especially as we age. However, many older adults experience difficulties with sleep, leading them to turn to over-the-counter sleep aids. Medications such as diphenhydramine, found in Benadryl and many PM pain relievers, and doxylamine, found in Unison, are common choices due to their sedative effects. These substances are effective in promoting sleep, but their anticholinergic properties can adversely affect memory and cognitive function, posing a risk for older adults. Diphenhydramine and doxylamine work by blocking histamine receptors in the brain, which induces drowsiness. Unfortunately, they also inhibit acetylcholine, a neurotransmitter crucial for memory and learning. The cognitive side effects of these medications can be particularly concerning for older adults who are already at a higher risk for memory problems and cognitive decline. Users may experience confusion, difficulty concentrating, and short-term memory loss, which can significantly impact daily functioning and overall quality of life. Given these risks, it's important to consider alternative approaches to managing sleep issues that do not involve anticholinergic medications. One effective strategy is to establish a regular sleep routine. Going to bed and waking up at the same time every day helps regulate the body's internal clock, making it easier to fall asleep and stay asleep. Additionally, creating a calming pre-sleep routine, such as reading a book, taking a warm bath, or practicing relaxation techniques like deep breathing or meditation, can signal to your body that it's time to wind down. Number 2. Medications for urinary incontinence or overactive bladder. Anticholinergic medications are frequently used to treat urinary incontinence, a common condition among older adults that involves the involuntary leakage of urine. Drugs such as oxybutynin and tolterodine work by relaxing the bladder muscles, which helps control urinary urgency and frequency. However, these medications also come with the potential downside of impairing cognitive functions. Because they block acetylcholine, essential for memory and other cognitive processes, these drugs can lead to memory loss, confusion, and other cognitive issues. Individuals taking these medications for urinary incontinence should be particularly vigilant about monitoring their cognitive health. It's important to discuss the risks and benefits with your doctor, especially if there are concerns about memory loss. In some cases, doctors might recommend lower doses, shorter treatment durations, or even alternative therapies that do not carry the same cognitive risks. Non-anticholinergic options, such as mirabegron, have been shown to effectively manage incontinence with a reduced impact on cognitive function. In addition to medication, lifestyle modifications can also help manage urinary incontinence while minimizing cognitive risks. Practices such as pelvic floor exercises, bladder training, and dietary adjustments can offer significant relief from symptoms without the need for anticholinergic drugs. Combining these strategies with a thorough evaluation of all medications being taken can provide a comprehensive approach to managing urinary incontinence in a way that supports overall cognitive health. Number 3. Cold and allergy medications. Many cold and allergy medications contain anticholinergic ingredients that can negatively impact cognitive health. Decongestants like pseudoephedrine and phenylephrine are often combined with antihistamines such as diphenhydramine or chlorpheniramine in multi-symptom relief products. While effective in alleviating symptoms of colds and allergies, these combinations can pose a risk to memory and cognitive function, particularly for older adults. Pseudoephedrine, commonly found in products like Sudafed, works by constricting blood vessels in the nasal passages and reducing congestion. However, its anticholinergic effects can contribute to side effects such as confusion and memory impairment. Similarly, phenylephrine, found in many over-the-counter cold and flu medications, can also have anticholinergic properties that impact cognitive health. It's important to read labels carefully and be aware of the active ingredients in these medications. When managing cold and allergy symptoms, consider alternatives that do not contain anticholinergic components. Newer generation antihistamines like loratadine, Claritin, and cetirizine, Zyrtec, are less likely to cross the blood-brain barrier and are therefore safer options for those concerned about memory issues. In addition to choosing safer medications, non-pharmacological approaches can help manage symptoms effectively. Using saline nasal sprays, staying hydrated, and employing natural remedies such as honey for cough relief can provide symptomatic relief without affecting cognitive function. Keeping your living environment clean and free of allergens can also reduce the need for medication. Number 4. Antidepressants with anticholinergic properties. Tricyclic antidepressants, TCAs, including amitriptyline and doxepin, are often used to treat mood disorders and certain types of chronic pain. However, their anticholinergic properties can negatively impact memory and cognitive function in older adults. TCAs work by blocking the reuptake of neurotransmitters like serotonin and norepinephrine, but they also inhibit acetylcholine, which is essential for memory and learning. This inhibition can result in cognitive side effects such as memory loss, confusion, and difficulty concentrating. Older adults are particularly vulnerable to these side effects due to naturally declining acetylcholine levels and age-related changes in drug metabolism. The cognitive risks associated with TCAs make it important to carefully evaluate their use, especially for individuals already experiencing memory issues or cognitive decline. Newer classes of antidepressants, such as selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs, are often preferred for older adults because they generally have fewer anticholinergic effects. Medications like sertraline, citalopram, and venlafaxine can be effective in treating depression and anxiety without significantly impairing cognitive function. It's important to discuss the potential cognitive risks of antidepressant medications with your pharmacist, particularly if there is a concern about memory. Your pharmacist can help weigh the benefits and risks of continuing or starting a TCA and may suggest alternative treatments that are less likely to affect cognitive health. Number 5. Medications for gastrointestinal issues. Gastrointestinal issues such as irritable bowel syndrome, IBS, and other digestive disorders can significantly impact daily life, prompting many older adults to seek relief through medication. Anticholinergic medications like hyoscyamin and dicyclamine are often prescribed to manage these conditions. These drugs work by relaxing the muscles in the gastrointestinal tract, which can help reduce symptoms like cramping, pain, and irregular bowel movements. However, while they can be effective in alleviating digestive discomfort, their anticholinergic properties can also pose risks to cognitive health, particularly for older adults. Hyoscyamine and dicyclomine inhibit acetylcholine, a neurotransmitter crucial for memory and cognitive function. By blocking acetylcholine, these medications can lead to cognitive side effects such as memory problems, confusion, and difficulty concentrating. This can be especially concerning for individuals over 60 who may already be experiencing age-related cognitive decline. It's important for older adults to be aware of these potential risks and to discuss them with their physicians. For those dealing with gastrointestinal issues, there are several strategies and alternative treatments that can help manage symptoms without the cognitive risks associated with anticholinergic medications. Dietary changes can be a first line of defense. Identifying and avoiding trigger foods, such as those high in fat, caffeine, or certain fibers, can help reduce symptoms. Keeping a food diary can be useful for tracking which foods exacerbate symptoms and which ones are better tolerated. Number 6. Medications for Parkinson's disease. Parkinson's disease medications, such as benztropine, are crucial for managing symptoms like tremors and muscle rigidity. However, many of these drugs have anticholinergic properties that can adversely affect cognitive functions, including memory. This is particularly concerning for older adults who may already be experiencing age-related cognitive decline. Benztropine, for example, works by blocking acetylcholine, a neurotransmitter involved in muscle control and cognitive processes. While this action can help alleviate Parkinson's symptoms, it also disrupts the brain's ability to process information, leading to potential memory impairment, confusion, and reduced mental clarity. Given the cognitive risks, it's essential for patients and caregivers to monitor any changes in memory or cognitive function closely. Communicating these changes to your doctor can help in making informed decisions about treatment options. In some cases, doctors might recommend adjusting the dosage or considering alternative medications that pose fewer cognitive risks. For instance, some newer Parkinson's medications aim to manage symptoms without significantly impacting acetylcholine levels, thereby offering a potentially safer option for those concerned about memory. Additionally, incorporating non-pharmacological therapies such as physical therapy, exercise, and cognitive activities can also support overall brain health and mitigate some of the cognitive side effects associated with anticholinergic medications. Number 7. Antipsychotic medications. Antipsychotic medications are essential for treating a range of psychiatric conditions, including schizophrenia and bipolar disorder. However, many of these drugs have anticholinergic properties, which can lead to cognitive side effects like memory impairment, confusion, and reduced mental clarity. This is particularly concerning for older adults who may already be experiencing age-related cognitive decline. Older individuals taking antipsychotic medications should be vigilant about monitoring their cognitive health. Drugs such as olanzapine, quetiapine, and clozapine are known to possess anticholinergic effects, which can exacerbate memory issues. It's important for patients and caregivers to communicate any noticeable changes in cognitive function to their doctor promptly. In some cases, alternative medications with fewer anticholinergic properties may be available. For example, some newer antipsychotics are designed to minimize cognitive side effects while still effectively managing psychiatric symptoms. Healthcare providers can help tailor a treatment plan that balances the need for symptom control with the goal of preserving cognitive function. Lastly, muscle relaxants. Muscle relaxants like cyclobenzaprine are frequently prescribed to alleviate muscle spasms and pain, offering much-needed relief for those suffering from musculoskeletal conditions. However, these medications can also have significant anticholinergic effects, which may pose risks to cognitive health, particularly for older adults. Cyclobenzaprine, for instance, works by blocking acetylcholine, which can interfere with brain functions crucial for memory, attention, and overall mental clarity. Older adults are particularly vulnerable to these cognitive side effects due to natural, age-related changes in brain chemistry. Consequently, the use of muscle relaxants should be approached with caution, especially if there are existing concerns about memory or cognitive decline. Patients taking these medications should be closely monitored for any signs of confusion, memory impairment, or decreased mental alertness. It's also essential to discuss these risks with a healthcare provider who can help evaluate whether the benefits of using muscle relaxants outweigh the potential cognitive downsides. In some cases, lower doses or alternative treatments may be recommended. Non-pharmacological methods such as physical therapy, stretching exercises, and heat or cold therapy can also provide significant relief from muscle pain and spasms without impacting cognitive health. Being proactive in managing muscle pain through safer alternatives and lifestyle modifications can help minimize the reliance on medications that may jeopardize cognitive function. I hope this video helped you better understand the potential risks of anticholinergic medications, especially if you're concerned about memory loss as you age. Remember, if you're taking any of these medications, never stop them abruptly without consulting your doctor. There are often safer alternatives that can provide the same benefits without the cognitive risks. Staying informed and proactive about your health is key to aging well and maintaining your memory. Thanks for watching, and don't forget to like, subscribe, and share this video with others who might benefit from this information.